a periapical lesion, what does that mean? It means that there's a disease process beyond the root, and oftentimes they're pressurized, especially if the patient is symptomatic. So what does that mean? It means that the pressure from sitting at the apex actually can nudge that tooth just slightly out of its alveolar housing, right? So now instead of the tooth sitting in its natural position, it's slightly elevated out of position. What does that cause? More occlusal trauma, right? So now the patient is pounding on that sore pressurized tooth. What else happens? As the tooth is pushed up, now it's not as secure in its support housing. So now you get some mobility. So where a fracture needs to be considered, as we've talked about so many times, obviously radiographically, that sort of J-shaped lesion should at least raise a red flag, but we've talked a lot about how the pulpal diagnosis would tell you one way or the other. So for instance, if you have a periapical